Hi guys, today's topic is HIV and AIDS. In HIV means human immunodeficiency virus. AIDS mean acquired immunodeficiency syndrome. In first of all, we can discuss about symbol of HIV and AIDS. What is the symbol and where it will be? Who is invented this symbol? In which year? How it will be happen? All are things we can discuss about. In red ribbon becomes a symbol of HIV and AIDS. Awareness in 1991 when visual AIDS. In 1991 HIV and AIDS symbol will be introduced. The symbol of HIV and AIDS is red ribbon. A group of New York based artists, in New York based artist it will be introduced in HIV and AIDS symbol and HIV activity diseases to provide a visual symbol to raise awareness and show support for those living with HIV. Who are living with HIV, they can show the visual symbol to that person. This is the symbol for you, your body and your things, and they can give awareness to the peoples. Okay, first of all we can discuss about the symbol of HIV and AIDS. HIV symbol is red ribbon. In 1991 it will be introduced in New York based one of the New York artists. It will be shown the who are present faced the problem to HIV and AIDS. They can show that persons to this is the symbol. They can give awareness to that persons. Okay, next when we celebrated AIDS Day. In World AIDS Day we can celebrate it 1st of December. Every year December 1st we can celebrate the World AIDS Day. Okay. Next, HIV and AIDS. AIDS means acquired immunodeficiency disease or syndrome. It is a disease caused by the retrovirus human immunodeficiency virus. AIDS is caused because of HIV symptoms. In human, any person they got HIV symptoms, they can identify if this person got AIDS disease and characterized by profound immunosufficiencies that leads to opportunities infections, secondary neuroplasm and neurological manifestation. In HIV and AIDS, it can be mostly affected the body parts. It will so many diseases are occur in a human. It will be first of all it can the immunosufficiency is not affected to human. It can infections are occur, neuroplasm and neurological, these all are affected to the humans. The acquired immunodeficiency syndrome AIDS was first recognized in 1981 in US. In AIDS was first identified in 1981 in US country, United States of America. Okay. Next, this is the structure of HIV and AIDS. In your body, it will be shown like you can in a HIV disease. It can shown like this sun. Okay, no. Next, you can discuss about causes of AIDS. AIDS is caused by HIV infection. Mostly AIDS are occurred from HIV disease. The main cause of AIDS are behaviors that increase the risk of getting and transmitting HIV. It will be most of the thing. How can it affect it to? You can transmit your things to one to another. I mean, in HIV disease you can transmit it. For example, you and your friend both are you can eat one fruit, you can share that one only to your friend also. That type also this disease is transmitted from one to another person. The virus attacks the immune system, leveling the individual susceptible to life-threatening infections and cancers. It is also humans are most of villages side somewhere that they don't eat food items. There will be very immunity power less, and that persons also this virus will be attacked. Next, symptoms. An AIDS is a virus infected the symptoms related to HIV infection can be similar to flu or other virus illness like symptoms. Mostly there are so many symptoms are present. We can explain only 10 to 12 symbols only. Symptoms. Fever is the first symptom. Because of AIDS disease in your body, fever, muscles and joint pain, chillness, headache, sore throat, night sweat, red rashes, mouth sore, tiredness, swollen lymph glands, weakness, weight loss, diarrhea. These all are symptoms occur in your body AIDS disease is present. Next, how HIV infection affects the body. So how HIV disease affects the body? How can it affect the body? Like mouth sore, swollen lymph nodes, fever and chillness, rashes, muscle ache, night sweat, diarrhea, sore throats, fatigue. These all are affected to the HIV. How it transmitted from non-human to human? How can only human to human not this disease is transferred? This disease also transferred. Non-human to human also transmitted. HIV is classified into two types. There are HIV-1 and HIV-2. In HIV-1 transmitted from chimpanzees and gorillas to human. In transmissions there are two types. One is HIV-1 and HIV-2. In HIV-1 is transmitted from chimpanzees and gorillas. Next one, HIV-1 is mostly closely related to Simon immunodeficiency virus found in chimpanzees and gorillas in West to Central Africa. In HIV-1 is found in West to Central Africa in chimpanzees and gorillas. HIV-2 transmitted from sooty mongoose to human. This is the sooty mongoose. This is also one type of monkey. HIV-2 is mostly closely related to SIVs found in sooty mongoose in West Africa. In HIV-1 is present, they will find in West Central Africa, in West Africa. Okay. Next, transmission of HIV. How HIV is transmitted? Transmission through blood. The most common case is by sharing, scissoring and needles through blood transfusion activities. If one person has HIV, you can use that person's blood. Automatically that virus also transmitted from your body. And also one person using needle, you can use same needle for another person, and that time also it will be transmitted. Transmission through pregnancy from mother to fetus. Report has shown that over 500,000 of infants affected HIV during pregnancy or breastfeeding. In one mother has a HIV, automatically in the baby also present in HIV, because pregnancy time also this will be happening. Next, uses of contaminated needles and scissors. You can use already used needles and already used scissors. These all are automatically the virus also transmitted. Age-wise distribution of report AIDS caused in India 2024. In 2024, how HIV and AIDS are affected? How much percent from which age is mostly affected in this one? 16 to 25%, 15% only affected. 26 to 35%, 57% are affected. 36 to 45, 14%. 46 to 55, 14%. Above 55, there is only 0%. Above 55, the disease is not affected. Most of time in 26 to 35 age group members only affected this disease. How HIV is not transmitted? How HIV is not transmitted? In using handshakes, hugs, closed mouth kisses, contact with objects like toilet seats, doorknobs or dishes, mosquito sticker or other biting insects, air or water, tears, spit, urine and that are mixed with the blood of the person with the HIV. sharing dishes, silverware or drinking glasses, swimming in same pool, using the same toilet seat. These all are not affected, not transmitted the disease. Okay. Testing for AIDS. What are the kits you can use for testing? First kit is enzyme liquid immunosurvey assay. This kit is used for the first positive. It will be present positive. The test is usually repeated to confirm the diagnosis. First you can test using this kit. It can be keep positive. You can repeatedly until it will be yes or no confirmation. You can use this kit. If enzymes linked to immunosuppression is negative, other tests are not usually needed. If it is possible, you can use all kits. Next to all three steps. If it is positive, you can move to the next. You can move to, if it is in this test HIV are present positive, the test is usually repeated to confirm the diagnosis. It is positive, you can move to the next step. If it is negative, you can stop from the first step matram. Okay. Next, Western blot test, a confirmation test for HIV. It is the confirmation test, second step. In third step, 4-count test. It will be cells are present or not. What are the conditions? White blood cells is, you decrease the white blood cells, you can use this kit. Now nucleic acid test is the last step. Last test. A nucleus test is a blood test that can be detected HIV and measure the amount of HIV in the body. How much HIV is present in your body? In fourth step, it will be occurred. In test for AIDS, first step it is positive or negative identified. It will be positive in HIV. You can move to the second step, second test. In second test, you can confirm the confirmation the HIV. In third step, white blood cells are decreased or not, you can measure. In fourth test, you can blood test that can detect the measure the amount of HIV, how much HIV in your body present. It will be identified. Prevention of HIV. Thought healthy educated. You can educate it to other people how are they are managed to, how can they be treated, and these all are things. Never share needles, syringes or other drug injections. You don't share anything, needles, syringes, the usual things. Okay. Thought counseling. Proper checking of blood during blood donation. Before you can donate it, you can check you have any virus, you have any disease are presented. That all are things. Avoid of contact with blood and fluid by wearing proteins, clothing, mask and glucose, etc. Help to prevent transmission in blood. Wearing masks. That all are you don't share to other persons. Okay. Thank you guys.